Perfect. Here's a full set of Puerto Rico Medical Board-style clinical vignettes focused on cell cycle regulation with 4 answer choices and detailed explanations. Perfect for boards and revalidation prep. Clinical Vignette 1, The Guardian of the Genome. A 48-year-old man presents with a rapidly growing mass in his colon. Genetic testing reveals a mutation in a gene responsible for arresting the cell cycle in G1 in response to DNA damage. Loss of this gene increases the risk of multiple cancers. Which gene is most likely mutated? A. KRAS, C. P53, D. MIFI. 53. Explanation. P53 is a tumor suppressor gene that arrests the cell cycle at the G1S checkpoint in response to DNA damage. It either activates DNA repair or triggers apoptosis if the damage is irreparable. Its inactivation is common in human cancers. Clinical Vignette 2, G1S Gatekeeper. A 2-year-old girl is diagnosed with retinoblastoma. Genetic studies reveal a defect in the RB1 gene. What is the normal function of this gene? A. Promotes cell cycle progression. B. Suppresses E2F activity to prevent premature S-phase entry. C. Activates DNA helicase. D. Enhances RNA polymerase activity. Answer B. Suppresses E2F activity to prevent premature S-phase entry. Explanation. The RB protein binds E2F transcription factor, preventing it from promoting S-phase genes. When RB is phosphorylated by cyclin D CDK4/6, it releases E2F and allows S-phase progression. Clinical Vignette 3, Checkpoint Drug Design. A chemotherapeutic drug is designed to inhibit cyclin B CDK1. What part of the cell cycle will be blocked? A. G1S transition, B. S-phase, C. G2M transition, D. M. G1 transition. Answer C. G2M transition. Explanation. Cyclin B plus CDK1, also called MPF, is essential for mitosis initiation. Inhibiting this complex halts the cycle at the G2M checkpoint, preventing mitosis. Clinical Vignette 4, Cyclin D role. A young patient with familial melanoma has a mutation affecting a protein that regulates the cyclin D CDK4/6 complex. The deficient protein is encoded by CDKN2A. What protein is missing? A. P53, P3C, P-cyclin, D. cyclin E. Answer C. P-cysteine. Explanation. Inhibits CD4/6, preventing RB phosphorylation and uncontrolled entry into the S-phase. Mutations in CDKN2A lead to tumor susceptibility. Clinical Vignette 5, Cyclins in Action. A researcher is studying cyclin expression in HeLa cells. She notes that cyclin E accumulates just before the S-phase. What is the function of cyclin E? A. Triggers DNA replication. B. Forms the G2M checkpoint. C. Inhibits CDK activity. D. Drives cytokinesis. Answer. Triggers DNA replication. Explanation. Cyclin E plus CDK2 is active late in G1 and promotes transition into the S-phase, initiating DNA replication. Clinical Vignette 6, Cell cycle arrest. A lab engineer creates a knockout mouse model lacking P21. Which checkpoint will be primarily affected? A. Metaphase checkpoint. B. G1S checkpoint. C. G2M checkpoint. D. SG2 transition. Explanation. As P21, a CDK inhibitor induced by P53, inhibits CDK2 cyclin E, enforcing the G1S checkpoint. Without it, cells proceed even with DNA damage. Clinical Vignette 7, Cell cycle phases. Which phase of the cell cycle is characterized by the synthesis of DNA? A. G1, B. S, C. G2M. Explanation. The S phase is when DNA replication occurs. It follows G1 and precedes G2 in the cell cycle. Clinical Vignette 8, Oncogene overdrive. A patient with Burkitt lymphoma shows overexpression of MIC. What is the effect of MIC in the cell cycle? A. Blocks S-phase entry. B. Enhances transcription of cyclins. C. Induces P21 expression. D. Inhibits mitosis. Answer B. Enhances transcription of cyclins. Explanation. MYC is a proto-oncogene that upregulates cyclins and promotes cell proliferation. Translocation T814 in Burkitt lymphoma leads to its overexpression. Clinical Vignette 9, Chemotherapy target. Which chemotherapeutic agent specifically targets rapidly dividing cells by blocking microtubule disassembly in the M phase? A. 5-fluorouracil, B. Methotrexate, C. Paclitaxel, D. Cyclophosphamide. Answer C. Paclitaxel. Explanation. Paclitaxel stabilizes microtubules, preventing mitotic spindle disassembly, arresting the cell in M phase. Clinical Vignette 10, G0 phase. A 67-year-old man's liver is biopsied after trauma. Cells are seen re-entering the cell cycle. From what phase are they coming? A, M, G2C, G1, G0. Answer. Explanation. G0 phase is the quiescent phase, where cells are metabolically active but not dividing. Liver cells can re-enter the cycle from G0 in response to injury. Would you like a visual